Hello, I'm Dr. Jonathon Collopy, Executive Director at the Ryan Family YMCA. Today is World Mental Health Day, and we invite you to join us for a very special edition of our Be Well series. Joining me today are Christina Halme, licensed family therapist from the YMCA of San Diego County, Landon Donovan, co-founder and manager of the San Diego Loyal, and Dr. Patrick Frias and Dr. Benjamin Maxwell from Rady Children's Hospital. Please enjoy our conversation. Thank you all for joining this conversation. I recognize that lately there's been great media attention related to mental health. We've had many examples of professional athletes and celebrities sharing their life experiences of mental health, which I believe can destigmatize mental health. Landon, I validate you because early on you offered transparency and advocacy around mental health. From your perspective, I wonder, why are conversations like this important?
I'll use it as an opportunity to speak to my challenges that I had, and I wish I could pinpoint why I felt compelled to speak openly about it, because most people I meet do not feel compelled to speak publicly about it, and people who are in the public eye especially do not want to speak publicly about it. For some reason, I was at peace with it. I think probably because I had years of therapy and had processed it, that I felt secure in doing so. But thinking about now, having the ability to impact other people by speaking freely about it is really important. And so I wish I had had that. I wish I had had some role models to look up to. I'd heard about suicides or people dealing with depression or anxiety, but you didn't have people coming out and speaking about it in a real way, people you looked up to or idolized. And I wish I had that. So it's not why I was so forthcoming with it, but it's certainly a benefit of it.
As you share that, you're right, there wasn't those that kind of went before you. And so I wonder what the experience was like for you as you stepped out of that way and shared your journey.
I can share some very personal ones. Family members, as I was going through this process of understanding that probably even as a child, I was experiencing depression as a very young child through years of therapy and sort of looking back at myself. But when I would explain it to some very close family members, I would open up 15, 20 minutes, explain to them what it felt like, what I would go through. And then in one particular case, a family member said, I just don't get it. You're young, you're rich, you're healthy, you're famous, you play soccer for a living, and I just don't understand. And that was a big light bulb moment for me, where unless you've actually experienced it, it's really hard to have real compassion or empathy. It was eye-opening, because someone who was a blood relative that I had been so open with, still, they just couldn't process that was actually happening.
That's fascinating, and I hate to say it doesn't seem uncommon, because often people run into that experience. They work harder, try harder, do something different. If you just do that, and so that's part of why I appreciate that these conversations are very important to help provide education and enlightenment in that way. I want to stay with you for just a moment. I think of professional athletes and keen awareness about body and mind, how important the mental is for the physical and performance. And I just want to throw out your career as you're working with managing mental health and mental well-being, how you went about that in playing at the highest level as a professional athlete.
There's a lot there that I could speak to, but I'll try to keep it brief. I used to have coaches say to me, gosh, when everything off the field is going well, you play so well. But when you're not there mentally, it seems like your performance suffers. And this was pre-therapy and understanding that this was a challenge of mine. And I was, yeah, you're right. If something wasn't going well off the field, or if I was feeling down, so I wouldn't perform as well. And it shouldn't be a surprise to anybody that your mental state is going to affect your physical state. Now there's lots of data that actually supports it, science that supports it. But before it was kind of like, oh, well, you can just change your performance in the moment, even if you're not doing well in your life off the field. And I was very in tune with my physical body, but also my mental state. And I just knew that if one was off, the other would suffer and vice versa. And it was anecdotal at that point, but now it's a lot of data and science support that how much the mental affects the physical.
I appreciate how aware you are of mental health and the ability to kind of analytically take that on. And I would think about it as people share, just try harder, focus on the game. In many ways, that could just compound the experience.
No question. And that's frustrating, right? So you're talking earlier about your daughter, and you realize when you see children now, because now it's through the lens of my children, if they're opening up and emoting, telling you something, they don't necessarily want a response or an answer or what to do. They just want you to hear them. Just listen.
Yeah.
Right. And so we have learned in our house, my wife and I oftentimes just say, I can understand why you're feeling that. I'm sorry you feel that way, but you don't have to give an answer. And in sports, it's like, well, how can I help you do this? And how can I help you do that? And let's get into it. Well, maybe I just want to just be heard for a minute.
And that wisdom is very helpful in all relationships. I mean, I continue to practice that with my wife. And, I try to rush it and take care of it. But I need to come back to that particular mantra. So thank you. Recently, the U.S. Surgeon General, Dr. Murthy, was here in San Diego visiting the Jackie Robinson Y. And this is right after he issued that rare public advisory declaring a youth mental health crisis. Dr. Frias, I really appreciate you being here, and I think your presence and participating in a dialogue about youth mental health is really a testament to how important this is to you and to the hospital. And if you could, speak to what this community partnership means between Rady Children's Hospital, San Diego Loyal, and the YMCA.
Yeah, absolutely, Jonathan. I think it's even in our name, Rady Children's Hospital and Health Center. And you mentioned it, Landon mentioned it, there is no health without mental health. So we strongly believe that. So we're more than just the hospital where you come with a broken bone or cancer or all those other illnesses. It's also about their mental capacity. And those kids who need to recover through those difficult illnesses also need their mental health and mental well-being. So thank you, Landon, for helping remove the stigma, because we're easy to talk to our family when we have a broken bone and share that with them, but maybe not as much. It ought to be the same, though, when you have a mental illness and you need that support. So to us, it's very important as a health system. We're doing a lot. We have our inpatient unit. We have a psychiatric emergency department. We're actually growing our inpatient unit on the campus. But more importantly, it's how do we get out in the community? Because you don't solve this with inpatient beds in the emergency department. That's the tip of the iceberg. We need to be out in the community, and we can't do it alone. It takes a village to raise a child. It takes a village to care for the kids in our community. And if I think of who are two incredible partners in our community to lift this burden with, if you will, the San Diego Loyal with Landon at their helm. Landon actually, as I mentioned to you, he's on our mental health advisory board, making sure that we're going in the right direction and all we're doing for the community. And then you and Christina and everyone at the YMCA, you're focused every day about child health and well-being as well. So our mission's absolutely aligned, and all together and with others in the community, like the County of San Diego, we can get through this over time. We can tackle this problem.
Well, on behalf of the Y, I just want to say how fortunate we are to be in partnership with yourselves. You and I had a few minutes to talk before we started our program today. And you were talking about that this is a unique partnership. A lot of partnerships are in name, but you were saying this is the working partnership. And as you spoke to Landon being on the advisory committee for mental health, and we're fortunate to be a part of this as well. So I appreciate the significance of this particular partnership. So thank you. So Dr. Maxwell, the Surgeon General's declaration, he spoke of widespread increase in youth mental health issues. If you could share just what are you seeing in the hospital? What is the incidence, and how might the hospital be responding in terms of programs and services?
Right. So over the time that I've been in the past decade, we've seen massive increase in kids coming into our general emergency department with psychiatric crisis. In 10 years, it's gone up 28 times. So when I started there, we saw 160 psychiatric emergencies in the entire year. Now we might see that in a week. So as Patrick was mentioning earlier, we've got to figure out a way to prevent these emergencies from happening in the first place. So we're looking at early identification, prevention, early interventions that we can do, partnering with primary care pediatric offices, embedding behavioral health expertise in those locations, training pediatricians to deal with mild and moderate mental health problems, really trying to look at this from a system perspective to really change the way we're giving pediatric mental health care.
Can I jump in there just out of curiosity? I know it's a big question to ask why are we seeing it, but more importantly, I guess, is, it leads to the preventive piece, but why the uptick? And is it that there is something tangible in your opinion, plus what science says, or is it that it's always been there, we're just aware of it now? Great questions.
It's a great question, and it's a question I have urgency to answer. I mentioned earlier I have a 5-year-old daughter. I want her to have a wonderful and happy life and be surrounded by people that have that as well. You know, the things that have changed in the past 10 years that I've been a child psychiatrist: social media use, screen time use, sedentary lifestyles. Kids are less and less active than they were in the past, but they also have more pressure on them than ever before. Sports pressure, school pressure, parent pressure. To get into college now, the amount of effort and work that has to be done compared to when I was a kid, it's different. It's harder for parents now. I think it's harder for kids now. And that's really why we have this sort of 3-pronged approach to dealing with behavioral health at Rady. Change the healthcare system, support parents, and these sorts of collaborations, working with you guys. YMCA, social connection, exercise, those things are more powerful than anything I could do in an office. And so how can we come together? There is no a village to raise kids successfully. I think that's our opportunity that we have.
That's an excellent question. I appreciate the response. I was just stunned at what you said is the incidence of psychiatric emergencies. That 28-fold, that is alarming.
Well, and I think a lot of, since the pandemic, this has become a bigger issue and people have started talking about it. But it's important to realize the pandemic did not start this upward trend. Things have been changing for a long time, and thanks to people like Donovan, Landon, we're actually doing stuff about it now. This is our opportunity. I think there's a lot of reason to be optimistic.
Dr. Mack, please.
Can I ask a question?
Yes.
What do you hear in the clinics, in the hospital, direct from children and youth as the reason that they are suffering? What are they self-identifying?
Yeah, it's a great question. And on our inpatient unit in our emergency rooms, our behavioral health urgent care in Mid-City, most of those kids are having issues with social media in some form or fashion. The pressure of it, cyberbullying, this sort of idea that their life isn't as good as their peers. That's something that's a recurring thing. Social media is doing that. But I think there's another spin on the social media thing, that kids are spending more time on it and they're not doing things that are protective. Going to soccer practice, having a team, having a tribe of people around them. Exercise, 60 minutes of exercise, better than any antidepressant I could ever prescribe a kid. So how do we work together and try to get that information out to kids and families? It's cool because it's fun, but it also works. So it's better than going to a clinic, is go out, exercise with a group of people and have a lot of joy in your life.
But let's be honest, it's with young children, especially, it's a parenting issue. It's not that, everybody here knows, if you give a child an iPad, they'll sit on it for 15 hours, right? And if you're allowing that, you're complicit, right? So
it's a great question or comment in terms of parenting, because I think as a young parent, you're trying to do your best you can just to kind of keep the family moving forward. Christina, if you could share a little bit about just the journey of a parent, and there's almost kind of an evolution of how mental health gets managed in the home. That you're speaking to the parent's responsibility or relationship, just being aware of mental health in the home. And what does that look like developmentally?
Well, so I think that, number one is, you mentioned, right, is being aware of your own mental health as a parent, right? Your own mental wellness, or sometimes not mental wellness. Parenting's hard. So if we can practice our own self-awareness and we can model for children what that means, what does it look like when mom or dad or older sibling needs to take care of themselves in the moment, that goes a long way. I think when we help, it's really helpful when we can label emotions and name them, so that way we're teaching kids, and not just our own children, any kids we're coming into contact with, just being able to accurately identify emotions is an important thing, because then from there we can figure out, what do I need to do with this one? If this is an uncomfortable one, what are some skills, some tools I can use with adult help to help myself, ride that wave? And then I think as we get, to those teen years where I'm at, it gets a little different, because you don't get the control you had when they're younger. And so you hope that you've given them some, good foundational tools. And then you have to really just have very open conversations that are non-judgmental, that are very validating, so that it's a safe place for these teens to be able to talk, because they are going through a lot. Social media, right, and school, those are the two things that we hear, as well as family stressors, and that has a lot to do with socioeconomics that families are facing. And then you let them fly.
So I want to go back just to one comment that you made and highlight the awareness of a parent, because I think what you model as a parent, your ability to self-regulate yourself or be aware. So if I will, whoever would like to kind of respond or weigh into just that awareness and the modeling that a parent taught.
It's hard. It's hard. I'm always struck that you spend years and years and years, in most cases, not for us unintelligent people like me who didn't go to college, going to college to get a degree to learn what you want to do, but to be a parent, it can be more, right? And you don't learn, and you're not taught how to be. So parenting is really hard. What my wife is very good at and has helped me a lot with is apologizing when you make a mistake with your children. So that's a really big form of modeling. Everybody gets frustrated and fed up and upset sometimes, but then apologizing and saying, I'm sorry, I shouldn't have reacted that way. I think that's what struck me when you said that, as you asked the question.
And I recognize how your children look at that. I mean, there's the discourse that goes on, and that can be unsettling for them. And yet to see that work through, that it's remedied in some way, that someone is contrite, it's vulnerable to do that. So excellent.
I think the modeling of the social media, and I'm going to throw myself under the bus, not so much with social media, but with that little iPhone. I have 4 kids, and they're ranging in age from 14 to 24. So now we're down to just one in the house. When I mentioned to you, I have an executive coach, and at the beginning of that process, I did a 360, not only with peers and board members, but with my family as well. And the feedback from the family is that dad comes home and he's on this. And my day could probably go on all day and all night if I don't finally say, I just have to put it away. So I was clearly not being a role model for how to put that thing away. And just like you said, Landon, just be there, be present. And so I made a concerted effort to say, talk to my wife. There are times when I have to look at it, I'm going to put that thing down and put it away and walk away and spend more time with our daughter during the pandemic. I think probably a good thing of the pandemic is we spent more time together. And it's interesting lately what I've heard from her, some of the best moments she's had during it is just the time together and being present. So as a parent, Yeah, they're absolutely watching what we do. If I'm living my life on that device, they're probably going to do the same thing.
Yeah.
Christina, you mentioned the thing we hear most from kids, and that's exactly one of them is, I wish my parents spent more time with me.
Jeez, that's hard.
15, 16-year-old kid. I remember we used to go out to dinner or go on a picnic in the park. I just wish my parents would do that with me again. Kids in our emergency room. Most of the kids, more than anything, they want time and attention from their parents, more than their money, or certainly more than their advice or anything else like that. One of the things I've reflected on is something I asked my 5-year-old daughter is, how could I be a better father? To your vulnerability point. She's had all sorts of great. They've all been fun. That's a great.
And she's only 5.
She's only 5. I'm sure they're going to get even better.
That is wonderful. I want to kind of play a little bit on the social media because I know there's some great benefits with social media. But Landon, as an athlete, I wonder how social media comes to play. I think it's unique as a professional athlete today, in today's era of media and social media. So anything you want to say about that?
Yeah, a lot. So let's start with this. Anybody who claims that reading negative comments about them doesn't impact them is lying to you. And so early in the social media world, when I was first in the social media, which I'm always late to these things, but I don't know what year it was, but going through and reading potentially other human beings, in some cases, bots or whatever, talk to another human being as you that way or speak about you that way, of course it's going to impact you, right? And then the other side of this coin, which you guys will know well, is like the dopamine hit when somebody says something positive, right? Somebody you don't know. And that is just human. I mean, if you're saying that doesn't impact you at all, you're crazy. I have gotten to a point being 40 with 3 kids, happily married, where I can read it now and it doesn't impact me. But in the heart of my career, of course, that stuff impacts you. So just saying from somebody who was in it, that of course impacted me. I see it now through the lens as a coach with our young men in this case, and how they can be in training or in a game and know where cameras are. Wow. And that to me was like, I would never, ever, when I was playing, know where a camera was. I would have no idea. But they know exactly like type of shot or the type of thing. And when they're in the competitive moment, of course, they're not thinking through that. But if they score a goal, like, they know where to go, or they know what's going to be seen or what's going to be shown or what type of photo. And they're just aware of it. It's not, I don't know if it's good or bad. They're just aware of it. And in the past we weren't. And it's because this will show up on social media and it will look like this. And it's just the reality. And it's a reality we live in. And we also talk about it with present company here too, about how we showcase certain players versus others and how that impacts the whole team, how we showcase a young player who we're trying to potentially sign and how that impacts contract negotiations. There's all sorts of levels of stuff because it is really impactful to their lives and you just have to accept that.
Yeah. As you said that, I started to see through the lens of as you watch certain sports on TV and how they play with the camera now. And it is a very different dynamic. If I could stay with you, Landon, and have you speak to, because you opened that door as a coach, and what you offer as a coach, maybe from your own learning and wisdoms from playing and taking on those pressures, but you also have a unique perspective in terms of self-care. And so I just wonder, you would bring a lot to the table as a coach, you already do, but in the lens of mental health.
Very good question. So, as Christina said, having your own self-awareness first, so that when I first started, I wasn't intentional about everything I did as a coach. And now I'm not always perfect, but I try to be really intentional about, in an authentic way, when I'm saying something, what I'm saying to, who I'm saying it to. And I've grown in learning that. But there are, especially where we play, at the level that we play. We always say there's a reason why we're in the second division in the American soccer pyramid. So you have Major League Soccer, and then you have USL where we are. And there's a reason why in a lot of cases, certain guys aren't up here, right? There could be, maybe physically they're not as good, maybe technically they're not as good, but a lot of times their mentality is such that they get really down on themselves when they have a bad moment. They can't get through that, pass the rest of the game. And then, they go home and they're depressed all night. And so I've had so many experiences in the game as a player. I try to identify it, really try to identify it without being a psychologist or psychiatrist, but I've had enough experience to try to identify it and then speak to them honestly about it. You can't placate because players are smart. You can't BS them. They know if you're trying, if you're pandering, but if you can speak to them in an honest way and say, yeah, I had this moment in my career in 2008 where I went through the same thing, and this is how I dealt with it. I think a lot of times it helps because they see us, whether we like it or not, as mentors, and I think it helps them.
And to have compassion and share your life experience like that as teaching is, they're very fortunate to have you as a coach.
They might not say that.
I just offered it.
I appreciate it.
Christina,
Can I ask
please.
a question? Do you all as a club have mental health resources available
Great question.
that are there for everybody, because the pressure is for everyone?
Correct. So our resources now consist of our staff because we are aware. We have a gentleman who we refer guys to if they have an issue that is clearly impacting them. However, I have said for many years, fortunately, we don't have the resources. But at the higher levels, I'm always amazed that other sports teams, leagues that are spending tens, if not hundreds of millions of dollars on athletes don't have somebody that is at least there if needed. Right? It's a great question.
That's interesting.
Yeah, because I just see it firsthand every day with our team now. If you can get 1 or 2 or 3% better because someone's in a good mental place, forget about what it means to them as a human being, a person. But that's just good business. If you don't even care about them as a human being, which we do, that would just be the right thing to do. Just like getting a strength and conditioning coach is the right thing to do. Okay, so it always blows my mind.
And then you take that and expand the needs in the community. And so we recognize the pressure in professional sports, and we see the challenges at the hospital where people are coming in desperate need of services, and the challenges with equity and access and take advantage of those services.
That's right.
Christina, if you will, I know you've done a lot of work on adverse childhood experiences, and we've kind of walked around some of the challenges in the community. If you could speak to, because I know you're a steward for positive youth development, and speak to what that means today.
Well, I think that, and I'm thankful that there is so much more conversation going on around mental health for adults as well as for kids. And thank you for being, a hero who is willing to talk about it, because this helps carry this conversation. And my hope, as we were talking about earlier, is that it doesn't fade away. But I think that when we talk about mental health, we tend to frame it right in a negative. And mental health is a spectrum, and we've got wellness at one end. So what can we be doing all the time and in as many places as possible to be creating positive childhood experiences? Because those experiences, right, it's like saving money. You got a little bit in your savings account, and that's how you build resiliency, and that's where your grit comes from, because life inevitably gets difficult. So I think that, the YMCA obviously has tons of really wonderful programs and services, and it's really important that we're intentional about how and why we're doing the things we're doing so that we can make a positive impact on kids we have, the pleasure of being able to work with, and the families that we get to come into contact to. Youth sports, whether it's recreational or competitive, is another great venue to be able to create those bonds, right? Can I say it? many times connection is protection, and having peer relationships, having relationships with supportive adults goes a long way in terms of children feeling good about themselves, about developing a sense of competency and a willingness to try new things and difficult things. We need our kiddos to be able to figure out what they love, what brings them joy, where's the spark, and how can we help them, move forward with all of that. I think that there's a lot of positive movement going on, and my hope is that it'll continue in all of the major systems that come into contact with kids, especially the school systems.
Thanks, Dr. Frias, in terms of engaging more in our village to really bring about this systemic change. I wonder what your thoughts are. This is a great partnership, or we're doing some foundational work. Who else do we need to be a part of this so that it has even greater impact?
Yeah, I think we are, for one of our greatest partners as well, in addition to all of you, it's County of San Diego and the work that they're doing in connecting a lot of resources there. I think that's one of the benefits. I'm a transplant. I got here 4 years ago. And one of the things I've been so impressed with is the amount of collaboration across this community, and the fact that we're sitting in here today and asking these questions and putting tough questions out there. We'll get those other partners. And then for us as a children's hospital, we actually have deep connections. There are 8 children's hospitals in California. There are many, many more across the country, and we actually have collaboratives and partnerships with them. So how do we expand the work that we're doing, integrating mental health and primary care, and develop these models? This is just, what we do is just share seamlessly, steal shamelessly. and it's all in the benefit of enhancing child health. So we get these models, we pilot something, we understand it's working well, then we push it out to others as well.
Excellent.
I do want to add one thing also. I was sitting here listening to everybody and thinking there's, we talked about, and for us, our workforce is so critical. Mm-hmm. So not only are the kids who are ending up in the emergency room or ending up in our psych unit or anywhere else suffering from it, the staff that are taking care of them, they are absolutely suffering from this, because to see that every day and you come back to work and these kids keep coming through, it wears on you. And then our staff who are in the ICU, one of the terms we use is second victim. So there's a bad event on a child. Clearly, the first victim is the child and the family. But then the providers of care who woke up that day saying, I want to do the best thing for kids. That's why I want to devote my life to. And there's an outcome that's untoward. They're actually left alone. We have a program called You Matter. It was brought together by some nurses and restorative therapists. And I love the connections protection, because that's what it is. It's reaching out to their peers and saying, you matter, let's talk about this. And then we can get them the resources that they need. And in the current era, we are throughout healthcare, throughout our country, we're seeing actually workforce challenges, turnover and whatnot. And I think in healthcare, it's a real challenge that's exacerbated even by that second victim and the pain of seeing kids and others suffer. So we need to focus on them as well.
Mm-hmm. I really appreciate that you bring that forward, because as caregivers, there's often a selflessness, and yet there is a toll to that again and again. So I know at the Y, there's a great focus on this in terms of team well-being and taking care of our team so that we can serve others and serve the community. And as I speak to that, if I could have you look at, as part of this village, out in the community, there's other role models that come to play. And I wonder what thoughts are about those role models in the community, whether it's coaches, whether it's religious figures, whether it's neighbors, just thoughts about how we engage other role models, or what role models are important to each of you.
I think the schools are very important.
Yeah.
Teachers and our role models are people you see every day. That was one of the issues during the pandemic when schools were shut down and kids couldn't go. We also saw those things that normally teachers are able to see, that maybe there's something going on at home when they weren't there. So that's for us, how do we connect better with the schools and make sure that we tap into that resource to help the kids and help them.
The schools is a great point. There's physical education, which is important in schools. We don't always have a lot of social emotional education that happens there. I was at a conference this past weekend where one of the people there was embedding leadership principles that are taught to CEOs of big corporations, teaching that to 9th grade girls. Mm-hmm. And the impact they were able to see in just a year by giving them the same sort of teaching that the CEO of some big corporation might get. So I think there's ways we can do this. And if we start early, think of the change of trajectory of that person's life, really maximizing their potential.
Excellent point. Thank you.
I think that teachers, educators, staff on campuses also need support, right? Because their main job is either to keep kids safe on campus or to educate them. And there's not a lot of training that they get in their training in terms of how do you build a connection with a kid? How do you get to their level and connect with them as a person without having the pressure of we have to get through this much curriculum today or this week or this school year? I think there's a lot of pressure on them that makes it then difficult for them to feel like they have the time or the personal capacity to show up in really great relational kind of way.
As I think about those pressures, I think about some of the mental health challenges that come forward, whether anxiety, depression, and a lot of that is that the youth aren't allowed to just be and be present in the moment. They're worried about the homework or trying to get into a college or AP classes or the variety of stresses that you mentioned in terms of the social media. And just the ability to be present and just be a youth and develop and grow. And if I could, the why is founded on body, mind, and spirit. So we've spent time on body and mind. And so I wonder where spirit comes in as we speak of youth mental health.
I'll just speak to did not grow up religious, although we went to church every week because my mom sang in the choir. So I got some semblance of that. But the majority of the tenets that I hold dear to me are rooted in Buddhism. And it's funny you said when you said that, it's not a profound saying, but someone said to me once, and it's so great, that we are human beings, not human doings. And it's so true. And when you take time, so I was appreciative, Jonathan, of you in the beginning, just taking a moment with us to just settle. Meditation has been a huge part of my life. It's actually saved my life, which is a story for another day. But I think we have to remind our children of that. We're fortunate enough to go to our kids go to the same preschool. And the reason I love it, I think you would probably speak to the same, is they go there and they are playing and they are learning real life lessons through playing every day. They're 3 and 4 years old. They can learn how to read and write and do math a few years later. They have time, just let them be children. When I get home every day, I'm around a soccer field and soccer players all day. And I get home, my kids go, "Can we go play soccer?" And I'm like, oh, the last thing I want to do. But all they want to do is they just want to be and play and have fun. They don't want to go study math. They get time for that. So I just think it's an important reminder that as adults too, we are human beings, not human doings. And we all have busy lives. There's no question about it. But I really appreciate those moments because I come in tired and whatever. But I'm like, okay, but I was just present for the last hour.
And that was beautifully said, so thank you. I heard a question posed to you, and I love the question, so I will pose it back to you. And it was, Landon, what advice would you offer your younger self? And I will start with whoever would like, but I'd like each of you, if you would choose, to weigh in on that. Because as we get to stages of life, we kind of look back on why did I stress over this or sweat this and so, what advice might you offer that younger self? Because that's what we want to pass on, those wisdoms.
Wow. I think it's be present in the moment. And I think back, I went straight out of college, medical school residency, felt boom, 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 never really took the break. And I'm probably looking back at, I wish I would have maybe enjoyed that a bit more. Really, I spent 3 years in Durham, North Carolina at Duke University doing a pediatric residency. I don't really know Durham very well because I was not, I was in the moment of what I was doing there in the residency, but it's more the stop and smell the roses, I guess.
Beautiful.
I think for myself, it would be to trust myself and to trust my journey. It wasn't straightforward. I was not driven in that sort of linear way that you were. I just kind of I was fortunate enough to be able to meander, make it to college because it's so much harder now, and spend time doing things and learning about things I enjoyed, which I continued to do, and it got me to where I am today, and I love my job and the life that I have. But I don't know that I trusted in myself along the way. It was accidental.
Thank you.
Interesting.
Mm-hmm.
Sure.
Yeah, I think that being in the moment, I had the same path as you, high school, college, medical school, residency, fellowship, into a job and being present. But the other thing that comes to mind for potentially people that are slightly out of their teenage years is staying connected to those friends that you had in high school. When you leave, when you separate. I've done that with a few people, and I haven't done that with some other people. And I wish I stayed more connected with people and had these long-term, lifelong relationships, because when I have done that, it's been really valuable for me.
Great.
Do you remember what I said in my answer?
That's too easy. I'm gonna let you. No, actually, it may be different in this moment every day.
Yeah, it could be different. As you guys were saying, I was just saying, my dad always used to say to me, youth is wasted on the young. And it's so true. I mean, I guess I would say maybe it's turning 40 changed that for me. It's just like, it's going to be gone fast. It's going to be over fast. And so just in appreciating and fully enjoying what it meant to have no responsibility. You don't do that as a kid because everything seems hard and the end of the world and this and that, but life was so easy. It was so easy.
Thank you.
Can I have one more?
Please.
Yeah. I guess
Those learnings can be rich. There can be more than one.
Yeah, I mean, the other one that sticks out for me is, we were trained, I'm sure it was the same for you, goal set, right? Set a goal. And now you reach a goal, and a day or two later, it's like a letdown, and okay, what's the next thing?
Well said.
And so thinking through like systems to live by than goals to get to, or enjoying the process rather than the destination. There's a cliche in there, but the constantly chasing a goal sometimes can really be a recipe for lots of excitement and lots of letdown. And
I think that, can I add
Please.
as well? Because it's along those lines. I've talked a lot about this with my personal executive coach. It's don't get too high on the highs and don't get too low on the lows. And I think it goes back to what you said when people maybe do it looking at social media when they get up and down. I do maybe related on what's going on at work, and there's something really good that happened. The reality is it probably wasn't as good, or I didn't have as much an impact as you want to think. And when it's the lows, it's probably not as bad either. Try to really be more even keeled. And I look back on my life and maybe the swings emotionally, just have that even keel and just be present in that moment and not get too high or too low.
Sports give you that every day, right? Or every week for us, right? And it's because you have a result, a tangible result. And it's like, if you tie, which a long time I did, your success to which way that result went, you're going to be a miserable human being, right? And so like, just enjoying the process is so important. It's hard.
Because you can result the game behind you no matter what it was. You have to focus on the next one.
Well, so do you. I mean, it's in a different
It's
walk of
exactly
life. It's all happy.
Same focus.
Yeah.
And the same thing is it all passes. We want to hold on to those victories, those things that feel good, and the things that are unpleasant, uncomfortable, losses, disappointment, we want to push those away. And the one thing is just they will all pass. So just as your wisdom was earlier, to be in the moment, to be present for all of it, because it's all very rich.
what's your wisdom?
I was just going to ask. What would you tell your younger self?
It's a sprinkling, and I'm not going to just hijack, but it is a sprinkling of what has been shared. I've come to be a big believer in being present in the moment for all of it, all the richness of it. And also the realization of this is it. This is it. So show up, be present, embrace it, because this is it. And as you get to stages of life, it does go fast. My kids are grown, and we have a puppy now, and so life evolves, but it goes very quickly. So to really celebrate life and relationships, because this is it.
So
My last question, per se, we'll see. What hasn't been asked that needs to be shared?
what I would say, we talked about maybe the difficulties, but I want to put the glass half full side on it. We live in an incredible community where we actually are showing up and having this conversation. We do have from the county government to the state government to, and I'm not to be political, but it's true. In California, we have a lot of effort going into this, and we have the health systems, we have the various community-based organizations. Everybody wants to pitch in and do this. You don't see that everywhere. So I think for folks who are here in San Diego, the good news is, the bad news is there's a lot going on. There's a lot we need to fix with it. The good news is we have significant and meaningful engagement across our community. And we need to celebrate that and take advantage of it.
Excellent point. Really important. Thank you.
I'll echo that. 10 years ago, I wouldn't be sitting in the room with you, and I wouldn't be with the CEO of a big children's hospital talking about this, figuring out ways to find solutions. So it's people like you that have really allowed this conversation to really get going and allowed San Diego and Rady Children's Hospital, Loyal, YMCA to be part of the solution that hopefully could be exported to the rest of the country to really change the way pediatric mental health is approached in our country.
Excellent. So where does this call to action go from here?
Out to the community, get involved, engage, get past the stigma. I think folks like Landon are willing to speak up and be there to be present and help us solve it.
Thank you.
And just invest. If we all invest in the children and the young people in our communities and in our lives, I think we can do a lot just with them.
We all have a role to play, most definitely. Thank you.
I think we've said it takes a village. It's a societal level challenge, and it's going to take societal level change and engagement in order to change this. The hospital isn't going to change it on their own. We can't do it without great collaborators, parents, families, grandparents, aunts, uncles, kids, everybody getting involved.
I see it as, I see there's two parts to it. The reactive part, we're getting, I think, better at just from what you all are doing. How do we get the proactive, preventative part better so we don't have this coming as often. So that's, and they're both important,
Yeah.
right?
Yeah, I appreciate that foresight, most definitely. Thank you all. Really a pleasure. I think we could just continue the conversation, and my hope is we will another time, but really a pleasure and honor to sit with all of you and be a part of this. So thank you all.
Likewise, thank you.
Thank you for the opportunity.